Larynx is part of the respiratory tube, and the primary function of larynx is protection of the airway towards the lungs. For example, while we swallow the food or liquids, the epiglottis, the lid over larynx, will be protecting the airway so that the unwanted substances should not enter the respiratory tube. So protection of the respiratory tube is the primary function. Then we can talk about the secondary function of the larynx, which is phonation, production of the voice. In the larynx, we have the vocal cords, which are vibrating and modulating the air passing through them to produce the vocals, the voice. But voice production is the secondary function. Primary function of larynx is always protection of the respiratory tube as the air is passing towards the lungs. Initially, we have the foregut developing from the endoderm, and in the cephalic portion, it will give one anterior diverticulum, which is respiratory diverticulum, also called as laryngeotracheal diverticulum. And from there, the larynx, trachea, bronchi, and the lung buds will be developing. And that is why the epithelium of the respiratory tube is having the same derivation as the gut tube, that is endodermal epithelium. Then as we talk about the skeleton of the larynx, it is made up of cartilages, mostly hyaline cartilage and partly elastic cartilage. Now, what is the embryological derivation? Usually we'll say that the head and neck mesenchyme is secondary mesenchyme, especially anterolaterally, more so when we talk about the pharyngeal arches. And this mesenchyme is coming from the neural crest cells, the secondary mesenchyme. Pharyngeal arch bones like the mandible bone, hyoid bone, they would have come from neural crest cells. But when we talk about the laryngeal cartilages, that mesenchyme is not secondary mesenchyme from the neural crest cell. It is mentioned by certain authors, laryngeal cartilages come from lateral plate mesoderm, that is primary mesoderm. So laryngeal cartilages are not from neural crest cell derived secondary mesenchyme, but they are from the primary mesenchyme, lateral plate mesoderm, developing in arch number 4 and 6. In arch number 4, we'll have the epiglottis, the lid over larynx, and most of the thyroid cartilage, the largest cartilage of the larynx. So thyroid cartilage and epiglottis, they develop from the 4th pharyngeal arch, whereas rest of the laryngeal cartilages, they will develop in the 6th pharyngeal arch, which will be including lower part of thyroid cartilage and then the cricoid cartilage, further arytenoid, corniculate, cuneiform, most of the laryngeal cartilages except for the thyroid and epiglottis, which develop in 4th arch. Remaining all will come from 6th pharyngeal arch. Then talking about the larynx muscle, they are skeletal muscles, and all skeletal muscles must come from primary mesenchyme, the paraxial mesoderm. So it is the paraxial mesoderm which will be forming the larynx muscles, further migrating to arch number 4 and 6. In fact, most of the larynx muscles develop in the 6th pharyngeal arch, except for one, which is cricothyroid muscle. Cricothyroid muscle, which is a tensor of the vocal cord and increases the pitch of the voice, develops in the 4th pharyngeal arch. Otherwise, most of the larynx muscles, they develop in the 6th pharyngeal arch. And since the cricothyroid muscle develop in the 4th pharyngeal arch, it is supplied by a branch of the superior laryngeal nerve, whereas all the other larynx muscles are supplied by recurrent laryngeal nerve, the nerve of the 6th arch. Then looking at the histology of the larynx, since it is part of the respiratory tube, it will be lined by respiratory epithelium, which is pseudo-stratified ciliated columnar epithelium with goblet cells. But there is an exception. Respiratory epithelium is absent from the true vocal cords, as they are prone to abrasion when the air is moving forcefully through the true vocal cord region, especially while we are coughing or sneezing. We need some epithelium which is resistant to abrasion, and you know that epithelium. The true vocal cords are lined by stratified squamous epithelium. Otherwise, rest of the larynx, it will be lined by respiratory epithelium. And one more point you can note is vocal cords under the mucosa, we do not have the mucus glands. So mucus glands are absent in the vocal cords. And as we mentioned about the type of cartilage, most of the larynx cartilage is hyaline cartilage. But there are exceptions, like if you remember, we have anemonic E-cube. For elastic cartilage, we have the epiglottis, eustachian tube, and external ear. So epiglottis, eustachian tube, and the external ear, E-cube, they have elastic cartilage. So epiglottis has elastic cartilage. Elastic cartilage is also present at the tip of the arytenoid cartilage. Corniculate, cuneiform cartilage. We'll draw a diagram and show where all we have elastic cartilage. But if we are focusing upon the largest cartilage, which is the thyroid cartilage, and below that the cricoid cartilage, And most of the arytenoid cartilage, they are all made up of hyaline variety. Then there come questions about the location of the larynx. The extent of larynx is from C3 to C6 vertebra, cervical 3 to cervical 6 vertebra. If we look at the superior border of the lamina of the thyroid cartilage, it will be lying at the disc between C3, C4 vertebra posteriorly, and that is the level where we find common carotid artery is bifurcating into two branches, external and internal carotid artery. So in the carotid triangle, the bifurcation of common carotid artery into two branches is happening at the superior border of the lamina of the thyroid cartilage, which is disc between C3, C4 vertebra posteriorly. So larynx is starting at C3 level and reaching C6 level. C6 level is important and is basically the lower cartilage of the larynx, that is the cricoid cartilage. So lower border of the cricoid cartilage is at the lower border of C6 vertebra, and that is where larynx will end and trachea will begin. Behind that, pharynx will end and esophagus will begin. So at the lower border of cricoid cartilage is the ending of larynx, pharynx and beginning of trachea, esophagus. And cricoid cartilage is also a landmark for taking pulse of the common carotid artery. At the anterior tubercle of transverse process of C6 vertebra, there is a tubercle called as Sacheniac tubercle, the carotid tubercle. You should not take pulse bilaterally simultaneously. Only one of that should be palpated. So at the anterior tubercle of transverse process of C6 vertebra, you can feel the pulse of common carotid artery. That is also at the level of cricoid cartilage. So these landmarks are important clinically and come as MCQs as well. Then comes the description of extrinsic and intrinsic ligaments of larynx, extrinsic and intrinsic muscles of larynx. Ligaments, as we understand, they are connecting two structures together and they'll be named according to the structures they are connecting. So if it is to the exterior, they'll be extrinsic. If they are to the interior, they will be intrinsic. And when you talk about extrinsic ligaments, they'll be connecting the larynx as a whole to the neighboring structures. Say for example, larynx being connected to the hyoid bone or larynx being connected to the trachea. So if you're talking about the ligaments like thyrohyoid ligament or cricotracheal ligament, they will be extrinsic ligaments as they are connecting the larynx cartilages with the superior hyoid bone or the larynx cartilage with the inferior tracheal cartilage. So these are extrinsic ligaments, which are sometimes also called as membranes. Then there'll be intrinsic ligaments or intrinsic membranes. They'll be on the inner side and lined by the mucosa of the larynx. Two of them are important. Like there'll be one supraglottic membrane, which is quadrangular membrane, and infraglottic membrane, which is conus elasticus. The upper free border of the conus elasticus will form the true vocal cords, whereas the lower free border of the quadrangular membrane will form the false vocal cord. We call them as false because they do not help us in vocals or sound production. Sound production is done by true vocal cords, which are inferiorly located, and in a diagram we can see both these intrinsic membranes and both the vocal cords. Then as we talk about the muscles, they can be extrinsic or intrinsic. Extrinsic muscles will be connecting the larynx as a whole with the neighboring structures, like larynx being connected to the sternum, sternothyroid muscle. It is extrinsic muscle. Or from the thyroid cartilage, some muscles attaching to hyoid bone, like thyrohyoid muscle. They will be extrinsic muscles and will be on the outer side of the larynx. They move the larynx as a whole. As we understand, while swallowing, the larynx is moving up and down, and these are the extrinsic muscles which will move the larynx up and down during swallowing. They could be suprahyoid muscle or infrahyoid muscle. Most of them, they will move the hyoid, but along with hyoid, the larynx will move because there are connecting membranes, the extrinsic membranes, and connecting muscles, the extrinsic muscles. But if you are talking about the intrinsic muscles of larynx, they'll be working upon the laryngeal inlet, whether to open it or close it, and the vocal cords, whether to separate the vocal cords or bring them close. If you bring them close, adduction of the vocal cord. If you separate, abduction of the vocal cord. So movement of the vocal cords, which is important for the protection of airway and production of the sound, and closing and opening of the laryngeal inlet. That will be done by the intrinsic laryngeal muscles. Then, as we talk about the vascularity of the larynx, it is closely related to the thyroid gland. So the vessels which supply the thyroid gland, they will also be giving branches to the larynx. For example, superior thyroid artery will give superior laryngeal artery to supply the larynx, and inferior thyroid artery will give inferior laryngeal artery to supply the larynx. And accordingly, the veins will have same name. The superior laryngeal vein will be draining into superior thyroid vein, whereas the inferior laryngeal vein will drain into inferior thyroid vein. And following these vessels, will be the lymphatics. Vocal cord is the watershed area which will decide. Lymphatics above the vocal cords, they will be following the superior laryngeal vessels or superior thyroid vessels, and the lymphatics below the vocal cords will be following the inferior laryngeal vessels and inferior thyroid vessels. Above the vocal cords, the lymphatics will be received by upper deep cervical lymph nodes, and below the vocal cords, the lymphatics will be received by inferior deep cervical lymph nodes. And one point of clinical relevance is vocal cords, they do not have lymphatics. And clinically, if there is a cancer involving the vocal cords, it will not be showing lymphatic metastasis at all because vocal cords have no lymphatics. And as we understand, larynx is important not only in the discussion of anatomy, but also in the ENT. ENT professor may be asking you some details about the larynx, about the clinical anatomy. So there will be some overlapping topics. For example, if you are using a mirror to have a visualization of the larynx from the superior view, that comes as a question. You may be given an image of the laryngoscopic picture or a dissected specimen, which is a transverse view of the larynx, or it could be a sagittal section. Already some dissected specimen have been asked where the examiner was asking about the skeleton of the larynx, but it could be one radiological picture as well, maybe sagittal or coronal. So questions can be in radiology or ENT, and you will answer them confidently if your basics of anatomy are well handled. As you understand, our teaching is specifically based upon the type of questions which keep coming in the exams. That gives us the framework. But along with that, we keep touching the topics which you should know for being a skillful, efficient physician or a surgeon. So let us begin on the topic by looking at one of the MCQ itself. This question is asking the false statement about the larynx. And as we see, choice number A is mentioning in the larynx there are 9 cartilages, which is true. As mentioned by most of the authors, there are 9 cartilages in the larynx, 3 paired and 3 unpaired. Now, when you say 3 paired and 3 unpaired cartilages will be in the midline, and you can enumerate them like the epiglottis, thyroid cartilage, and the cricoid cartilage. Whereas, if you look at the larynx from the posterior view, you'll find a pair of arytenoid, a pair of corniculate, and a pair of uniform cartilage as well. So, if you say there are 3 paired, there will be total 6 in number, whereas 3 unpaired, total 3 in number, 6 plus 3, 9 cartilages. So, there is no issue with the choice number A. It is a true statement, cannot be our answer, as the question is asking about the false statement. We also have understood that the larynx will be extending from C3 to C6 vertebra. Now, be careful. When nothing is mentioned, you have to consider this as normal adult male, because this statement for a female is not true. In females, the larynx is placed a bit higher, and in pediatric age group, it can be still placed very higher, especially while swallowing. Say one infant is suckling on the breast. At that time, you must have noticed the swallowing and breathing goes hand in hand. There is nasal breathing going on, and simultaneously, the baby is also sucking on the milk. So swallowing and breathing go hand in hand alternatively. And in that scenario, the epiglottis in an infant may be reaching as high as C1 vertebra, the atlas vertebra. So for pediatric age group, it can be very high. In a female, it can be at a higher level. But since this choice number B mentions nothing about pediatric age group or a female, any statement which is given as a simple statement must be considered as adult male. So I have no problem with choice number B as well. But I definitely have a problem with choice number C, because if you're talking about the external laryngeal nerve, it is a branch of superior laryngeal nerve, the nerve of the fourth pharyngeal arch. So fourth pharyngeal arch will have some muscles developing to be supplied by a branch of the vagus, that is superior laryngeal nerve. Vagus gives recurrent laryngeal nerve also, which is going to supply the sixth pharyngeal arch muscles. And in fact, most of the larynx muscles are developing in the sixth pharyngeal arch. So evidently they'll be supplied by the nerve of the sixth arch, which is recurrent laryngeal nerve, except one muscle, that is cricothyroid muscle. As we have mentioned, name of the muscles are according to the structures they are connecting. So connecting the cricoid cartilage with thyroid cartilage, you have cricothyroid muscle seen on the anterior aspect of the larynx, which is a tensor of vocal cord, so it will increase the pitch of the voice. This cricothyroid muscle is the only muscle of larynx which develop in the fourth pharyngeal arch. And since the cricothyroid muscle is developing in the fourth pharyngeal arch, it is to be supplied by superior laryngeal nerve branch, which is called as external branch of superior laryngeal nerve or external laryngeal nerve. So as you look at choice number C, external laryngeal nerve, which is a branch of superior laryngeal nerve, branch of the vagus, supplying the muscles of the fourth pharyngeal arch. For example, the cricothyroid muscle. Otherwise, all the larynx muscles, since they are developing in sixth pharyngeal arch, they should be supplied by recurrent laryngeal nerve. As you can understand, this statement is not a correct statement, and since it is a false statement, that will become our answer. False about larynx is choice number C. External laryngeal nerve will supply only one muscle of larynx, that is cricothyroid muscle. Otherwise, all larynx muscles are supplied by recurrent laryngeal nerve. And then, as I mentioned, of course, cricothyroid muscle, which is connecting cricoid cartilage with the thyroid cartilage, is a tensor of vocal cord and increases the pitch of the voice. Choice number D is a correct statement. The false statement is only choice number C. We'll keep that as our answer and go further with the details. We can draw a diagram where we are talking about the cartilages, the paired and unpaired, and also we can mention about the various muscles and their actions as well, briefly. Let us look at the larynx from the anterior and the posterior view. Say this is the anterior view of the larynx, where we'll be showing some of the cartilages, but some of the cartilages can be seen only from the posterior view. Now, in the anterior view, we can show the largest of all the larynx cartilages, that is the thyroid cartilage. So here is the thyroid cartilage from the front view, and we can also show the epiglottis cartilage. Epiglottis is behind the thyroid cartilage and is spoon-shaped, or some authors will say leaf-shaped cartilage. It attaches to the thyroid cartilage on the interior at the thyroid angle. So a leaf-shaped structure or a spoon-shaped structure is the epiglottis. And as we were talking about the embryological derivation, the epiglottis and most of the thyroid cartilage will be coming from the fourth pharyngeal arch, except for this lower part of the thyroid cartilage. Rest all. So most of the thyroid cartilage and also the epiglottis, both of them are coming from the fourth pharyngeal arch. So fourth pharyngeal arch will be giving us two cartilages, that is the epiglottis and the upper part of the thyroid cartilage. And as we have mentioned, they are not coming from the neural crest cell derived mesenchyme, they come from the primary mesenchyme, lateral plate mesoderm. So larynx cartilages, they are coming from lateral plate mesoderm. Now fourth arch has given two cartilages. What about the rest of the cartilages? They'll be coming from the sixth arch, which will include the lower part of the thyroid cartilage. Below that will be the cricoid cartilage. From the posterior view, the arytenoid, corniculate, cuneiform. All of them are coming from sixth pharyngeal arch. So let us look at the cricoid cartilage now. Cricoid cartilage is the only ring-shaped cartilage. And when you say it is a ring-shaped cartilage, you can mention signet ring-shaped cartilage. Means it will be seen not only from the anterior view but also from the posterior view. It will be completely covering the respiratory tube. You know, in the respiratory tube, there is no cartilage which will be encircling the respiratory tube completely. This thyroid cartilage is only present anterolateral. Epiglottis is only anterior. It is the anterior wall of the larynx. But cricoid cartilage is in a ring-shaped fashion. Even if we talk about the trachea will have C-shaped cartilages. That means they are not complete. They are present anterolaterally. Posteriorly, they'll be deficient. But cricoid cartilage is a ring-shaped cartilage encircling the respiratory tube completely. Comes as a question. So we can see the cricoid cartilage not only anterior but also posterior. Posteriorly, it will be bigger in appearance, forming what is called as lamina of the cricoid cartilage. Otherwise, anterolaterally, it is having what is called as arch of cricoid cartilage. So anteriorly will have the arch in the cricoid cartilage and posteriorly will have the lamina, which is larger. And articulating with the cricoid is the pyramid-shaped arytenoid cartilage. So here is the pyramid-shaped arytenoid cartilage, and sitting on the arytenoid cartilage, articulating with it, will be the corniculate cartilage. And more superiorly and more anteriorly, there will be a rod-shaped cartilage, and that is called as cuneiform cartilage. So as we can see, there are three paired cartilages which can be seen more evidently from the posterior view of the larynx. So a pair of cuneiform, a pair of corniculate, pair of arytenoid. 3 plus 3 is 6, plus cricoid is 1 in the midline, as is thyroid and epiglottis. So 3 cartilages in the midline, the unpaired cartilages, and 3 paired cartilages. 3 plus 3 is 6, plus 3 9. Total 9 cartilages, all developing from lateral lateral plate mesoderm, primary mesoderm, where the epiglottis and the upper part of thyroid cartilage will be developing in fourth arch. Otherwise, lower part of thyroid cartilage, cricoid and arytenoid corniculate cuneiform, they all develop in sixth arch. So you can mention here the lower part of the thyroid cartilage, cricoid and rest all larynx cartilages, they are developing in sixth pharyngeal arch, lateral plate mesoderm. Then talking about the muscles of the larynx are basically skeletal muscles, so they must come from paraaxial mesoderm. The paraaxial mesoderm will form the somites. Somites will form the skeletal muscles, and they'll be migrating into arch number 4 and arch number 6. Most of the larynx muscles develop in arch 6, except for one, the cricothyroid muscle, which develop in fourth arch. Let us show the cricothyroid muscle here. As we have mentioned, the name of the muscles are according to the structure they are connecting. So there'll be one on right side, one on the left side. We are looking from the front view, and this is the cricothyroid muscle. So cricothyroid muscle is attaching to the cricoid cartilage and the thyroid cartilage. One on the right side, this is front view, and one on the left side is the only muscle developing in fourth pharyngeal arch, supplied by a branch of superior laryngeal nerve of the fourth arch. Otherwise, rest all muscles will be supplied by a recurrent laryngeal nerve, the nerve of sixth arch, as the muscles develop in sixth pharyngeal arch. Now, what is the function of cricothyroid muscle? As we discussed in the question, it is a tensor of the vocal cord, and it will be increasing the pitch of the voice. Like if you compare the male and female, the female will have high pitch voice, and that gives us an idea that if a male wants to sing in female voice, then he has to train this muscle. The name is cricothyroid muscle. So a male can train his cricothyroid muscle and modulate his voice, learn to increase the pitch of his voice, and can sing in a female voice. If you have the knowledge of this sa re ga ma, in sa re ga ma, when you start with sa, it is a low pitch voice, but then there comes another sa, which will be high pitch voice. Let me give you a demonstration. For sargam, you start with sa re ga ma pa dha ni sa. That sa is high pitch, and to sing that high pitch sa, you have to train this muscle, cricothyroid muscle. Then only you can sing the high pitch sa, as you need to tense your vocal cord with the use of cricothyroid muscle. Then how do you relax your vocal cord so that you can sing in low pitch voice? Like male voice is low pitch voice compared with the female, and in the sargam only you can go backward also. Like normally we say sa re ga ma, but then if you go backward, sa ni dha, now there is a lower pitch. How do you do that? Here I have to relax the vocal cord. So which muscle is relaxing the vocal cord? And for that you can draw the muscle and name it accordingly. You can tell me when I draw a muscle connecting thyroid cartilage with the arytenoid cartilage. So it becomes obvious. The names are according to the structures they are connecting, and the muscle will be called as thyroarytenoid muscle, coming from the thyroid cartilage anteriorly and runs anteroposteriorly so that it can attach to the arytenoid cartilage posteriorly, and hence the name is thyroarytenoid muscle. And it is this thyroarytenoid muscle which is a relaxer of the vocal cord. And if you relax the vocal cord, you will reduce the pitch of the voice, and the voice will become heavy. Usually the male voice is heavy and the female voices are high pitch voice. But then obviously a female can train some of the muscles and can sing in male voice. So which muscle a female will be training so that she can sing in male voice? It's the opposite, the relaxer. Like if you know the singer Usha Uttup, if we are listening to the singing of Usha Uttup, you'll find that she has the capability of singing even in male voice, and she must have trained one of her muscle, which is the relaxer of the vocal cord, to reduce the pitch of the voice, and that is thyroarytenoid muscle. Especially the medial part of thyroarytenoid muscle, which attaches to the vocal cord, called as vocalis muscle. So in the thyroarytenoid muscle, medially there is a small part of it which is called as the vocalis. Vocalis is a part of thyroarytenoid only, and we can train this vocalis muscle to relax the vocal cord and reduce the pitch of the voice and sing in heavy vocals. That is what you say bass. Bass is given by the thyroarytenoid vocalis muscle, whereas the treble is given by the tensor of the vocal cord, the shrill sound. But then came a question. It was asking, vocalis muscle, which is the medial part of thyroarytenoid muscle, is not only a relaxer of the vocal cord, but it is also a tensor of the vocal cord. So which part of the vocalis is relaxer and which part is tensor, anterior or posterior? That was the question. As you will notice in this diagram, I have written mention it on posterior side. So you should remember, it is the posterior part of the vocalis muscle which is the relaxer, because anteriorly it is a tensor of vocal cord. So now you have two tensor muscles which can be remembered. The anterior part of vocalis muscle is working with cricothyroid muscle as a tensor of vocal cord, whereas the posterior part of the vocalis muscle is a relaxer of the vocal cord. As I say, you keep practicing MCQs to remember this kind of information. Now tell me the name of this muscle which is attaching cricoid cartilage with the arytenoid cartilage posteriorly, and according to their attachment and the location, you can name the muscles. So what is the name of this muscle? It is present on the posterior side, attaching cricoid and arytenoid, hence the name is posterior cricoarytenoid muscle. And this posterior cricoarytenoid muscle is the safety muscle of larynx. Now, why would you say posterior cricoarytenoid muscle is a safety muscle of the larynx? Because this is the only muscle which is going to abduct the vocal cord. Otherwise, most of the larynx muscles are adductors. So, the only abductor of vocal cord, the only muscle which will separate the vocal cord is posterior cricoarytenoid muscle. Otherwise, most of the larynx muscle, they are adductors. They close the vocal cord. And what will happen if the vocal cord is closed? The individual cannot breathe. So, who is maintaining the safety? To breathe, you must open the vocal cord. And to open the vocal cord, you have only one muscle. That is a safety muscle. So, only abductor of vocal cord which will help us to breathe is the posterior cricoarytenoid muscle, as its location is posterior, attaching cricoid and arytenoid cartilage. It is called as the safety muscle of larynx. Though it is rare, but occasionally there might be bilateral damage of recurrent laryngeal nerve while doing total thyroidectomy. So while doing thyroidectomy, if there is damage to the recurrent laryngeal nerve bilaterally, then both the posterior cricoarytenoid muscle will be paralyzed. And as you are doing the reversal of anesthesia, patient becomes conscious, immediately he develops dyspnea, stridor, difficulty breathing, because the vocal cords, they are unable to abduct. The safety is gone, and this can lead to asphyxia, death of the patient. In such an acute scenario, you have to immediately do endotracheal intubation. Because the larynx is closed, the patient has to breathe from the trachea, or you may have to put a tracheostomy tube. If larynx is closed, the patient is supposed to breathe from the trachea, and you have put a tracheostomy tube. In fact, when you are doing general anesthesia, you are supposed to give muscle relaxant, which will relax the skeletal muscle. But then these muscles, like posterior cricoarytenoid muscle, this is also a skeletal muscle. So your muscle relaxant is going to relax the posterior cricoarytenoid muscle also, and the larynx will be closed. So what is the essential prerequisite before giving muscle relaxant or general anesthesia? You already would have put a tube, endotracheal tube, because you know after muscle relaxants, the larynx is closed. Patient is supposed to breathe from trachea. And once you do the reversal of anesthesia, then only you can remove endotracheal tube. So here we have seen one muscle which is abductor of the vocal cord. Then we have mentioned most of the larynx muscles are ADD adductors of the vocal cord. And then we have seen one of the tensor of vocal cord, added one more here, the cricothyroid muscle which is located anteriorly, and the anterior part of the thyroarytenoid muscle. So two tensors and one relaxer, that is posterior part of the vocalis, is a relaxer of the vocal cord. We will be looking at some of the diagrams again to revise this information. And in this diagram, we are revising the cartilages of the larynx, 3 paired and 3 unpaired. If you say the unpaired, they'll be in the midline. Like this is from the front view, you can see the lid over larynx, the epiglottis. Then we have the thyroid cartilage and the cricoid cartilage. So these 3 are midline unpaired cartilages. And if we want to see the paired cartilages, we will have to look from the posterior view. In the posterior view of the larynx, we can see the 3 paired cartilages, a pair of arytenoid. On the top of that will be the cornicate, and still anterosuperior will be the cuneiform, one on each side, right and left. So 3 paired cartilages seen from the posterior view will be the arytenoid, cornicate and cuneiform. And this is the posterior view of the epiglottis, but it is only one in the midline. Can be seen from the posterior view, from the lateral view as well. Now starting with the largest cartilage of the larynx, the thyroid cartilage, it has 2 lamina, one on the right side and one on the left side. They meet in the midline to form a laryngeal prominence called as Adam's apple, more prominent in male as compared with female, and it is forming anterolateral covering of the larynx. These lamina, they will have superior horns and inferior horns also. So this is the front view of the thyroid cartilage. We have shaded one half of the thyroid cartilage here, the right half. This is the left half. Now looking from the side view, the thyroid cartilage, you can see the left lamina. So this is going to be the left-sided lamina of the thyroid cartilage. And again, you can see this is the superior horn and inferior horn of the thyroid cartilage, which is also seen from the posterior view of the thyroid cartilage, but it is open on the posterior side. So this is one of the lamina I am shading here, and then superior horn, inferior horn. And this is the other sided lamina from the posterior view. It is covering larynx anterolaterally, but posteriorly it is deficient. So this is the superior horn and inferior horn. Now you can notice the inferior horn of the thyroid cartilage is articulating with the cricoid cartilage, making cricothyroid joint. This is from the posterior view. You can see cricothyroid joint from the lateral view as well. And this cricothyroid joint is a synovial joint, allowing free movement. So thyroid cartilage can be having a tilting movement on the cricoid cartilage at the cricothyroid joint, and this movement is free movement. It is this joint which can help us to tense and relax the vocal cord, hence increasing and decreasing the pitch of the voice. That movement happens here. Now this was the thyroid cartilage. Let us focus upon the cricoid cartilage as well. As we have mentioned, cricoid cartilage is a ring-shaped cartilage. Can be seen from the anterior view, where we will have the arch of the cricoid. This is the lateral view of the cricoid, and as we go posterior, it will become slightly wider and making what is called as the lamina of the cricoid cartilage. And it is the lamina of the cricoid cartilage which is allowing the articulation with the inferior horn of the thyroid cartilage to form cricothyroid joint. So this is the lamina seen posteriorly in the cricoid cartilage, and it is a complete ring, signet ring shaped structure covering the respiratory tube in a circumferential manner. Now this was the cricoid cartilage. Let us talk about the third unpaired cartilage, which is the epiglottis, a lid over the larynx. Seen from the anterior view, from the lateral view, as we have mentioned, the epiglottis is spoon-shaped or leaf-shaped structure. It attaches to the thyroid cartilage on the interior, or you can say posterior side. Between the two lamina, we have angle of thyroid cartilage in the midline, and on the angle is attaching the leaf-shaped or spoon-shaped thyroid cartilage. It is placed obliquely at an angle which can be seen in the next diagrams, but the three midline cartilages or unpaired cartilages are the epiglottis, thyroid and cricoid cartilage. Then we can focus upon the paired cartilages as well. Like here, the pair of arytenoid cartilage. It is a pyramid-shaped cartilage, one on the left side and one on the right side. So this is the right-sided pyramid-shaped arytenoid cartilage. It will be articulating with the cricoid cartilage and making a joint which is called as cricoarytenoid joint. And again, this cricoarytenoid joint is a synovial joint, freely mobile joint. So may it be the cricothyroid joint or cricoarytenoid joint. Both the joints which the cricoid cartilage is making are synovial joint for free movement. And the movement which happens at the cricoarytenoid joint will be helping us in adduction and abduction of the vocal cord. So movement of the vocal cord will be happening at this joint, and the muscle which we were talking about, posterior cricoarytenoid muscle, that posterior cricoarytenoid muscle will be basically moving this joint. The only abductor of the vocal cord works at this joint, connecting the cricoid with the arytenoid cartilage. Now this is a pair of arytenoid. On the top of that you can see is a pair of corniculate cartilage. So here we have the corniculate cartilage which is sitting on the apex of the arytenoid cartilage, and it is also paired. Then on the superior and anterior aspect, a rod-shaped cartilage, the cuneiform cartilage can be mentioned. So here we are looking at another paired cartilage which is the cuneiform cartilage. And we have to remember the epiglottis, cuneiform, corniculate and the tip of the arytenoid, they are all elastic cartilages. Normally when we talk about the larynx, we say larynx cartilage is made up of hyaline cartilage, but there are some exceptions. If you are talking about the hyaline cartilage of the larynx, it will be the thyroid cartilage, the cricoid cartilage and most of the arytenoid cartilage. So the thyroid cartilage, cricoid cartilage and most of the arytenoid cartilage will be hyaline cartilage, but not the tip of the arytenoid. The tip of the arytenoid, corniculate, cuneiform and the epiglottis, these are going to be elastic cartilage. Let me draw the diagram here showing the posterior view of the larynx and talking about the elastic cartilages. Say this is the arytenoid cartilage on both sides, and arytenoid cartilage at the tip will be made up of elastic cartilage. Rest of it is hyaline. So most of the arytenoid cartilage is hyaline except the tip, and along with the tip of arytenoid, the corniculate or the cuneiform or the epiglottis, they are all made up of elastic cartilage. So name the elastic cartilages in the larynx. There are 4 names. What are the 4 names in the larynx which are elastic cartilage? They are tip of arytenoid, corniculate, cuneiform, and the epiglottis. So these are the cartilages which will be yellow elastic cartilages. And we have to remember the elastic cartilages, they do not calcify or ossify. It is the hyaline cartilage which has high tendency of calcification and ossification. So which part of the larynx can undergo calcification and ossification? That is most of the arytenoid and the cricoid cartilage and the thyroid cartilage. So thyroid, cricoid, and most of the arytenoid, since they are made up of hyaline cartilage, they have a high tendency to calcify and ossify. Not the tip of arytenoid or corniculate or cuneiform or epiglottis, because they are made up of yellow elastic cartilage. They do not calcify, they do not ossify. And these are all MCQs which have been asked recently and repetitively. You must keep on practicing MCQs to understand that why I specify and keep repeating some of the information in the discussion always. Now here we have to talk about some of the ligaments. We have mentioned earlier extrinsic ligaments and intrinsic ligaments. Extrinsic ligaments will be on the exterior, external. Like you can see here, a ligament connecting thyroid cartilage with the hyoid bone called as thyrohyoid ligament. This thyrohyoid ligament is extrinsic or external ligament. Now let us look at one more extrinsic ligament which lies to the exterior of the larynx. Name you can think yourself is decided by the structure they are connecting. So cricothyroid ligament. This is the cricothyroid ligament attaching cricoid with the thyroid cartilage on the exterior. So extrinsic ligament, external ligament. One more external ligament can be seen which is connecting the cricoid with the tracheal ring. So this is the cricoid cartilage, this is the first tracheal ring, and the ligament here will be cricotracheal ligament. One of the extrinsic or external ligament can be shown here also, cricotracheal ligament, the extrinsic ligament. So we have seen the 3 extrinsic ligaments, namely thyrohyoid ligament, which is evident here as well, and then the cricothyroid ligament running between cricoid and the thyroid cartilage, and then we have shown the cricotracheal ligament running between the cricoid cartilage and the first tracheal ring. These are external or extrinsic ligaments. But then in the next diagram we'll be looking at the intrinsic ligaments of the larynx, which will be on the inner side and they'll be lined by mucosa. We have to focus upon 2 of them, supraglottic and infraglottic. In the supraglottic region, we'll have the quadrangular membrane, and in the infraglottic region, we have the conus elasticus, formed by the cricovocal ligament. The upper end of the conus elasticus or cricovocal ligament will form the true vocal cords, whereas the lower free end of the quadrangular membrane will form the false vocal cord. Will be more evident if you take a coronal section of the larynx and look inside the larynx, because this time we are talking about intrinsic ligaments, which can also be called intrinsic membranes. Membranes and ligaments, they are used interchangeably here, and these membranes or ligaments on the interior will be lined by laryngeal mucosa. So let us look at the next diagram for the details then. And here we are looking inside the laryngeal cavity. Laryngeal cavity is divided into 3 levels or 3 portions, which can be seen in this coronal section, which is right to left section, and the posterior wall of the larynx has been removed so that you can see only the anterior half of the larynx. Like on the anterior wall of the larynx, we have this epiglottis, and posterior wall we have arytenoid, but they have been removed so that we can look inside the larynx, lined by laryngeal mucosa. Divided into 3 levels or 3 portions. This region is the glottis. Otherwise, there will be one supraglottic region, and then we have the infraglottic region. In the glottis region, we'll have the true vocal cords, which are also called as vocal folds. In fact, there will be some vocal ligaments covered by the mucous membrane of the larynx, making the vocal fold, or what is called as the true vocal cords. Then there are false vocal cords also. So here, inferiorly, these are the true vocal cords, whereas more superiorly, the vestibular fold are the false vocal cords, because they are not helping us in any vocalization. The voice production, phonation is done by the inferior or the true vocal cords. So here we are looking inside the larynx, but only the anterolateral part of the larynx because posterior part has been removed in the coronal section to look inside the larynx. And the anterior wall of larynx is made by this leaf-shaped structure or spoon-shaped structure, which is called as the epiglottis, lined by laryngeal mucosa on the interior and attaching to the thyroid angle, which is still more anterior in the larynx. So where the two lamina of the thyroid cartilage meet, that is the thyroid angle, and on the interior is the attachment of the epiglottis. This can be explained in a sagittal section also. Here we have taken a sagittal section and left half of the larynx has been removed. So we are looking on the medial view of the right half of the larynx. For orientation, we can discuss there will be a hyoid bone here, and that hyoid bone is magnified and shown here. So this is the hyoid bone. But you have to remember, hyoid bone is not the skeleton of larynx. Larynx has no bones in the skeleton. Larynx skeleton has only cartilages. Hyoid bone is shown because it has certain attachments. Otherwise, it is not a part of larynx. Comes as a question again. So this is the hyoid bone. Below that will be the larynx. And since it is a sagittal section, you can see a part of the thyroid cartilage here. So this is the thyroid cartilage, and below that is the cricoid cartilage. Since cricoid cartilage is a complete ring, you can see anteriorly it is having a cricoid arch and posteriorly it is having a cricoid lamina. So that is the posterior cricoid lamina, and it is a ring-shaped cartilage in which we can see only the right half of the cricoid cartilage here. Earlier we were talking about extrinsic ligaments, which can be discussed again. Cricoid cartilage was having cricotracheal ligament, one extrinsic ligament, and cricothyroid ligament, extrinsic ligament. Thyroid cartilage itself had one ligament with the hyoid bone, thyrohyoid ligament, and they can be called as membranes also. So thyrohyoid membrane, cricothyroid membrane, cricotracheal membrane, we have discussed they were extrinsic or external membranes. But then we wanted to discuss internal or intrinsic membrane. One was supraglottic, the quadrangular membrane. The other was infraglottic. The conus elasticus or cricovocal ligament is the other name. So what are the three levels or three portions of the glottis? As we have mentioned, there will be a glottis region, which is shown here, and above that will be the supraglottic region, whereas below that will be the infraglottic region. The glottis region is basically the region where we have true vocal cord. So this inferior one, which can be seen here, is the true vocal cord, which is extending anterior to posterior and is attaching to the thyroid angle anteriorly. So this is the thyroid cartilage. In the midline it will have thyroid angle and attaching to the thyroid angle anteriorly, then running posteriorly to attach to the arytenoid cartilage posteriorly. So this is a cut section of arytenoid cartilage. As we understand, arytenoid cartilage will be articulating with the cricoid cartilage, forming cricoarytenoid joint. So this is the cricoid cartilage. On the posterior side, sitting on the top will be arytenoid cartilage, and attaching to the arytenoid cartilage posteriorly and thyroid cartilage anteriorly is the true vocal cord, which is also called as the vocal fold, which is mucosal fold covering the vocal ligament. We'll continue discussing these structures, but then you have to understand this true vocal cord is the upper free end of a ligament, which is kind of a triangular ligament attaching to the arch of the cricoid cartilage. So attaching to the arch of cricoid cartilage, you see this membrane, which is a triangular membrane, and this membrane is called as cricovocal ligament, forming conus elasticus. So here, this is the conus elasticus. As the name is telling, it is fibroelastic membrane covered by laryngeal mucosa attaching to the arch of the cricoid cartilage, whereas the upper end is free, and that upper free end is forming the true vocal cord. That is why it is also called as cricovocal ligament, as it is attaching to the cricoid cartilage and upper end is forming the vocal cords. Hence the name of this triangular membrane extending from the arch of the cricoid is also called as cricovocal ligament. Now this was the cricovocal ligament, which is present on the interior of the larynx in the infraglottic region. This is one of the intrinsic membrane of the larynx. The same can be seen here as well. First of all, let us mark the cricoid cartilage. This is the cut section of the cricoid cartilage. Only the anterior half half of the cricoid cartilage is evident. We are looking from the posterior view. The posterior part of the larynx has been removed. We are looking at the anterior wall of the larynx, where you can see the cut section of cricoid cartilage, the arch of cricoid cartilage, and extending from there, attaching to the arch of the cricoid cartilage, extending superiorly, is the conus elasticus, or what we are calling as the cricovocal ligament. So this is the cricovocal ligament or conus elasticus. It is fibroelastic membrane under the mucosa. You can say submucosa. So under the mucosa, in the submucosa, there is a fibroelastic membrane made up of collagen fiber, elastic fibers, more of elastic fibers, hence the name elasticus. So it has one upper free end, and that upper free end of the conus elasticus, that upper free end of the cricovocal ligament is forming the true vocal cord or the vocal fold. Then what about the supraglottic membrane? Here we are discussing the infraglottic intrinsic membrane. What about the supraglottic intrinsic membrane? That was quadrangular membrane. This quadrangular membrane attaches to the lateral aspect of the epiglottis and runs anteroposterior towards the arytenoid cartilage. We are showing it on the left side from the posterior view, and we can show it on the right side as well from the posterior view of the larynx. So attaching to the lateral margin of the epiglottis and running anteroposteriorly from there towards the arytenoid cartilage, which lies posterior, is this membrane, which is called as quadrangular membrane. It is again in the submucosa, fibroelastic membrane covered by the laryngeal mucosa. So this is the quadrangular membrane, and the lower free end of the quadrangular membrane is going to form what is called as the false vocal cord or the vestibular fold. So this is the superior fold, which is the false vocal cord and is formed by the quadrangular membrane, inferior free border of quadrangular membrane, whereas the superior free border of the quadrangular membrane, which can be shown here, is forming what is called as, it will be evident to you since it is coming from the epiglottis to the arytenoid cartilage posterior, it will be forming the epiglottic fold, as the names are according to the structures they attach. So posteriorly we have arytenoid cartilage which have been removed, but running between arytenoid cartilage and epiglottis you will have epiglottic fold. So quadrangular membrane, upper border is free, lower border is free. Lower border forms false vocal cord, which is also called vestibular fold, and the upper free border running anteroposteriorly is called as epiglottic fold, running between arytenoid cartilage and the epiglottic cartilage. And embedded in that epiglottic cartilage will be the two cartilages, cornicate and cuneiform. So if you rub this off, you can see those cartilages are evident here, can be shown on this side as well. What we find here will be cornicate cartilage on either side sitting on the arytenoid which has been removed. So this is the cornicate cartilage, and more anterior superior, the rod shape, will be the cuneiform cartilage. Now may it be the cornicate or the cuneiform cartilage, both of them are embedded in the epiglottic fold. So this is the epiglottic fold, and in the epiglottic fold are embedded the cornicate and cuneiform cartilages lined by the laryngeal mucosa. And you know, all the laryngeal mucosa will be respiratory epithelium, pseudo-stratified ciliated columnar epithelium, except the true vocal cords, because true vocal cords will be prone to abrasion. They are accordingly lined by non-keratinized stratified squamous epithelium. Now this was the interior of the larynx, supraglottic region. In the supraglottic region we had quadrangular membrane. Quadrangular membrane was having upper free border and lower free border. Lower free border is the false vocal cord, upper free border is the epiglottic fold. The same thing can be seen in a sagittal section as well. So in the sagittal section in the supraglottic region, the larynx has three regions: supraglottic, glottic and infraglottic. And in the supraglottic region we are having the quadrangular membrane. So where is quadrangular membrane? You see, this is the epiglottis, which is placed in an oblique fashion, attaching to the thyroid angle anteriorly. So attaching to thyroid cartilage, this is the epiglottis, the lid over the larynx, and attaching to the lateral edge of the epiglottis a membrane is running towards the arytenoid cartilage, and that membrane is called as quadrangular membrane. So this is going to be the quadrangular membrane. Quadrangular membrane in a sagittal section can be seen on the interior of the larynx, lined by laryngeal mucosa in the supraglottic region, running from the lateral edge of the epiglottis towards the arytenoid cartilage. This is arytenoid cartilage here lying posteriorly, and that is the epiglottis here lying anteriorly. Running between the two is quadrangular membrane, and this quadrangular membrane has upper free border, which is called as aryepiglottic fold, as it is coming from arytenoid cartilage to the epiglottis, and it has a lower fold which is free and forming the false vocal cord. So this is the false vocal cord. False vocal cord are called false because they do not produce any vocals. They are just protective in nature, and they are the inferior free border of quadrangular membrane. So this is a sagittal section of quadrangular membrane, and this was the coronal section of quadrangular membrane. And in the upper free border, which is aryepiglottic fold, you are having corniculate and cuneiform cartilages, can be seen here as well. So in the aryepiglottic fold, we'll have the corniculate cartilage sitting on the tip of arytenoid, and still more anterior will be the rod-shaped cuneiform cartilage. So made with the corniculate or cuneiform cartilages, they will be embedded in the mucosa of the aryepiglottic fold. Now you might be wondering, what is the purpose of giving so many details in these diagrams? There's only one purpose. Already the examiner has asked the skeleton of larynx, giving a cadaveric section, marking A, B, C, D, and next time when the section will come, they'll ask you some deeper details, like they might be asking for quadrangular membrane and the false vocal cord, or the cricovocal ligament and the true vocal cords. So you must be prepared accordingly. That is my responsibility. And maybe in future you might become ENT specialist. That time you'll remember me. We must work upon our basics and strengthen them as much as possible. So this is how the examiner has asked the skeleton of larynx in your entrance exam, and we're marking the hyoid bone as A, epiglottis as B, thyroid cartilage as C, cricoid cartilage as D. As you can see, this is a sagittal section taken in the head and neck region to talk about the vocal cords in the larynx, the glottis region, supraglottic region, infraglottic region, and a magnified picture is there. But before we start discussing these details, let us make a schematic diagram which we already are aware of in a sagittal section. We can mention this is the cricoid cartilage showing the anterior arch and posterior lamina. This will be the anterior arch, and that is the posterior lamina. And sitting on the lamina of the cricoid cartilage, we can show the pyramid-shaped arytenoid cartilage. As we understand, they will be having a joint called as cricoarytenoid joint, which is a synovial joint for the free movement. That movement which is going to help us for the working of the muscles like posterior cricoarytenoid, which is abductor of the vocal cord. There can be lateral cricoarytenoid also, which is adductor of the vocal cord. We have to discuss all that, but this is the cricoarytenoid joint between lamina of the cricoid cartilage and the arytenoid cartilage, a pyramid-shaped cartilage. And sitting on the tip of arytenoid cartilage in a sagittal section, we can also talk about the corniculate cartilage. So here will be the corniculate cartilage in the side view in a sagittal section, and over that the cuneiform cartilage. Now once we have shown these cartilages, let us look at the cut section of the thyroid cartilage as well, and which can be shown here. This is the cut section of the thyroid cartilage. In fact, we have learned that thyroid cartilage, let us shift this diagram a little bit to this side, and as you understand, the thyroid cartilage will be having one lamina on the right side, one on the left side, and wherever they meet, they'll be forming the angle of the thyroid cartilage. Anteriorly, it will be the Adam's apple, but it is also called as angle of the thyroid cartilage. So this is just a cut section, sagittal section of the thyroid cartilage. You can also show the cut section of the hyoid bone here. So that will be the cut section of the hyoid bone. And then we have to talk about the epiglottis cartilage as well. Now this epiglottis attaches to the thyroid angle and is obliquely placed anterior to posterior and rises quite high up, even reaching above the hyoid bone. So this is the epiglottis cartilage now. Now once we have shown the epiglottis as well, we will put two extrinsic ligaments and two intrinsic ligaments. One of the extrinsic ligament you already have discussed. It was called thyrohyoid ligament, as it is connecting thyroid cartilage with the hyoid bone, and it is outside the lumen of the larynx, so it is extrinsic. One more ligament can be mentioned here additionally, called hyoepiglottic ligament, as it is attaching hyoid bone with the epiglottis ligament. ligament. So this is the hyoepiglottic ligament attaching hyoid bone with the epiglottis, and this is the thyrohyoid ligament which is attaching thyroid cartilage with the hyoid bone. Now these are the two extrinsic ligaments. Let us look at the two intrinsic ligaments also. We have already mentioned that coming from the arch of the cricoid cartilage, there is a cricovocal ligament forming the conus elasticus. So let us show that here. It is a triangular membrane coming from the arch of the cricoid cartilage, having one attached border to the arch of cricoid, but the other border is free, and that free border is forming the true vocal cord. So as we name the structure, this is the cricovocal ligament or conus elasticus. It is under the mucosa, layer of submucosa, fibroelastic tissue made up of collagen fibers but more of elastic fibers, hence conus elasticus. Between the arch of cricoid and upper free border, this upper free border is the true vocal cords. Now this true vocal cord, where is it attaching? It is the upper free border of the conus elasticus or cricovocal ligament, and it is attaching to the angle of the thyroid cartilage anteriorly and arytenoid cartilage posteriorly. Arytenoid cartilage will have one anterior process which is called as the vocal process. So attaching to the vocal process, which is anterior process of the arytenoid cartilage, is the vocal ligament, the true vocal fold or true vocal cord, one on right side, one on the left side, and we can oppose them adduction or separate them abduction by movement of this joint, which is cricoarytenoid joint. There are some muscles working here like posterior cricoarytenoid muscle for abduction, lateral cricoarytenoid muscle for adduction of the vocal cord. So this was the infraglottic space where you have the infraglottic membrane, the cricovocal ligament or cricovocal membrane, also called conus elasticus. What about the supraglottic space, which is also called as laryngeal vestibule? Laryngeal vestibule is the level 1 or supraglottic region. Level 2 is the glottic region. Level 3 is the infraglottic region. So what about the level 1 supraglottic region or the laryngeal vestibule? Which membrane there? It was quadrangular membrane, and the quadrangular membrane was attaching to the lateral border of epiglottis, and from there it was running towards the arytenoid cartilage, forming a fold here which is called as aryepiglottic fold, and embedded in this aryepiglottic fold were the cartilages, the cornicate cartilage and the cuneiform cartilage. So this is the aryepiglottic fold, the upper free border of the quadrangular membrane, whereas the lower free border of the quadrangular membrane will be forming the false vocal cord. So this is the membrane we are talking about, the quadrangular membrane, and this quadrangular membrane is located in the supraglottic region or the laryngeal vestibule, level 1 or the region 1 of the laryngeal cavity, and this quadrangular membrane has upper free border, aryepiglottic fold called so because it is coming from arytenoid cartilage towards the epiglottis, hence the name is aryepiglottic fold. So this is the aryepiglottic fold in which we have the embedded cornicate and cuneiform cartilages. And once we have drawn this schematic diagram, show the same detail in this dissected specimen as well. Let us first locate the cartilages, say first of all the cricoid cartilage. So here we can see the anterior arch of the cricoid cartilage and the posterior lamina of the cricoid cartilage. This is the posterior lamina of the cricoid cartilage, and then you can also see the anterior arch of the cricoid cartilage. So between the two, you can project the arch of the cricoid cartilage. The same can be done here. This is going to be the ring-shaped cricoid cartilage. Now once you have shown the cricoid cartilage forming the circumference of the laryngeal cavity, you can also show the thyroid cartilage. First you have shown the cricoid, now the thyroid cartilage, which will be a cut section. So cut section of the thyroid cartilage is seen here. This is the thyroid cartilage, and in an enlarged view, this is the thyroid cartilage, and attaching to the thyroid angle will be the epiglottis. So here is the epiglottis, the lid over the larynx. This is the epiglottis, leaf shape or spoon shaped structure in a magnified view, and the same can be shown here. Attaching to the interior of the thyroid lamina is the thyroid cartilage. It is made up of elastic cartilage, yellow elastic cartilage, whereas we understand the thyroid cartilage and cricoid cartilage are hyaline. They are prone to calcification calcification and ossification. This calcification begins at the age of 18 years onwards. But that ossification, calcification doesn't happen in the epiglottis. It doesn't even involve the tip of the arytenoid or corniculate or cuneiform, because the tip of arytenoid, corniculate, cuneiform and epiglottis, they are made up of yellow elastic cartilage, not prone to ossification. Now, once we have shown the epiglottis also, where is arytenoid cartilage? Arytenoid cartilage cannot be seen very clearly here, but this will be the location, and on the top of the arytenoid cartilage you will have corniculate and cuneiform cartilage. So this is the corniculate and this is the cuneiform cartilage. The same can be shown here. Sitting on the top of the cricoid lamina will be the pyramid-shaped arytenoid cartilage, and on the top will be corniculate and cuneiform cartilages, not very evident in the dissected specimen. Now, as we have mentioned, the arytenoid will have one anterior vocal process, and attaching to that anterior vocal process is the true vocal cord, and this true vocal cord runs anterior-posteriorly, attaching to the vocal process of arytenoid and the median angle of the thyroid cartilage anteriorly. So here you can show attaching to the vocal process of arytenoid anteriorly is running the true vocal cord towards the lamina, towards the angle of the thyroid cartilage, and this is the true vocal cord, which is nothing but the upper free end of the conus elasticus or cricovocal ligament. Let us show the cricovocal ligament now. Attaching to the arch of the cricoid cartilage, running superiorly, is the cricovocal ligament or the conus elasticus. The same can be shown here. Attaching to the arch of the cricoid cartilage, there is a triangular membrane, and that triangular membrane is the cricovocal ligament or conus elasticus. It is the upper free end of that which will form the true vocal cord. So this is the upper free end forming true vocal cord. Then who is forming this false vocal cord here? This false vocal cord will be formed by this quadrangular membrane, and this quadrangular membrane is basically in the supraglottic region in the laryngeal vestibule, attaching to lateral margin of the epiglottis, having two free borders. Lower free border is the false vocal cord and upper free border is aryepiglottic fold. In the aryepiglottic fold, we have already seen will be the two ligaments. So as you can see, this is the aryepiglottic fold attaching to the lateral margin of the epiglottis, and if we are talking about its lower border, a cut section can be seen here, is the false vocal cord. So this is the upper intrinsic membrane or quadrangular membrane, and in the quadrangular membrane, this is the cut section of lower free end forming the false vocal cord, whereas this is the aryepiglottic fold. This is the laryngeal vestibule, this is the glottis region, so that is supraglottic region, and this is the infraglottic region. Level 1, level 2 and level 3. Between the two vocal cords, the false vocal cord and true vocal cord, is the laryngeal ventricle. So this is going to be the laryngeal ventricle. The space between the two vocal cords is the laryngeal ventricle. Now you can see in front of epiglottis and behind the tongue, this is the vallicula or glossoepiglottic space. The same can be shown here. This is the vallicula, the glossoepiglottic space. And as we understand the epiglottis and posterior tongue, this epiglottis and posterior tongue, both of them will be supplied by the superior laryngeal nerve, branch of the vagus nerve, nerve of the fourth arch, because it is the fourth arch which will give us the posterior most tongue and the epiglottis. Epiglottis and the posterior most tongue are developing from the hypobranchial eminence embryologically. Embryologically, arch number 4 contributes to hypobranchial eminence, which itself will form posterior most tongue. This is the bulk of the tongue. So posterior most tongue and epiglottis come from hypobranchial eminence from the fourth pharyngeal arch. That is why their taste pathway or the journal sensation will be carried by nerve of the fourth arch, superior laryngeal nerve. That is the sensory supply, maybe journal sensation or taste sensation. Now we want to talk about pyriform fossa. And pyriform fossa will be in the laryngopharynx. This is the pharynx. Behind the larynx, so laryngopharynx, this will be oropharynx behind the oral cavity, and that will be nasopharynx, where eustachian tube is opening. So where eustachian tube is opening, this is the nasal cavity, nasopharynx. This is the soft palate, the uvula, the oral cavity. This is the hard palate. And as we understand, behind the oral cavity will be oropharynx. And then this is the laryngopharynx. Laryngopharynx will send the air we breathe into laryngeal vestibule through the laryngeal inlet, and this laryngeal inlet can be covered by the lid over larynx epiglottis to prevent the food entering into the respiratory tube. So the basic function of larynx is protection. Protect the airway from the fluid or the food matter. It will allow only the air inside the larynx and trachea and lungs. So where is the piriform fossa? Piriform fossa is just inferior to the vallicula, but it will be in the laryngopharynx. Cannot be seen here because it will be on the lateral aspect of the aryepiglottic fold. And if you want to see the piriform fossa along with the vallicula, then you have to put one laryngoscope. Look through the mirror and you can see all those structures. So laryngoscopic picture is also to be discussed because again, it has come twice in your exams. And in this diagram, you should also mark the hyoid bone. So this is the mandible bone, and below that, this is the hyoid bone. As we have mentioned, there will be a hyoepiglottic fold attaching the hyoid bone with the epiglottis, one extrinsic membrane. The same can be shown here as well. This is the hyoid bone, and the membrane will come like this, hyoepiglottic ligament, one extrinsic ligament for the larynx.